Let's discuss diagnosis according to 8 principles, excess conditions. Excess conditions are characterized by the presence of pathogenic qi in the body. Pathogenic qi will either be exogenous or internally generated. Furthermore, stagnation conditions are also defined as being excess conditions. The body's same qi is theoretically intact in an excess condition. In practice, though an excess condition can be such a burden on a person's same qi that it will often develop into combined deficient and excess conditions. Excess conditions can also rise from deficient conditions. This will therefore also be defined as being deficient excess conditions. Excess conditions that are caused by invasion of exogenous pathogenic qi will be acute, whereas internally generated pathogenic qi is usually more chronic in its nature. Even though a condition is chronic, it can still flare up with acute symptoms. The symptoms and signs seen in excess conditions tend to be more intense than those seen in deficient conditions, which tend to be milder. For example, vomiting in excess condition is often explosive, whereas regurgitation is more typical in deficient conditions. If there is pain or discomfort, they will be more extreme. The pain will not be alleviated by palpation in local area, but will usually be better with movement. The voice of a person with excess condition will be louder than if there is a deficient condition. There is also less likelihood of fatigue. A person may feel fatigue when there is a stagnation conditions, but this is a spurious form of fatigue. The fatigue that the person experiences is due to their qi not circulating around the body. When there is spurious fatigue, the person will usually feel pressure and more energetic after physical activity. The pulse will be powerful and the tongue will often have a thicker coating when there is excess condition. Excess conditions will often generate blood heat, pathogenic heat in the body. This means that signs such as red face, irritability, rough breathing, and constipation are often in general, though it can be difficult to generalize how excess condition will manifest. This is because there is so much variation in the types of pathogenic qi that can be excessive. Excess conditions can be summarized as follows: invasion of exogenous pathogenic qi, interior cold, interior heat, interior wind, ascending yang, dampness, phlegm, qi stagnation, accumulation of fluids, and blood stagnation. For the etiology, excess condition arises when the body is invaded by exogenous pathogenic qi, when there is internally generated pathogenic qi, or when there is a stagnation. For the symptoms and signs, symptoms that are acute, chronic symptoms can, though sometimes also be excess in nature. Intense or severe symptoms, pain or discomfort that is not relieved by palpation, symptoms that are relieved by activity and movement. Loud voice, heavy breathing, full pulse, thick coating on the tongue. Treatment principle is to expel, drain, or transform pathogenic qi, spread or dissolve stagnations. Thank you for your attention.